Good afternoon, everyone. Welcome to today's webinar hosted by the American Academy of Pediatrics and HealthyChildren.org. Today, we'll be discussing cough and cold season, upper respiratory tract relief, and ways you can manage your child's symptoms and more. Before we begin, here's a few housekeeping items. The webinar is being recorded. If for some reason you lose your connection or need to drop off, you can access the archived version on our website in a few days. If you have a technical issue during the webinar, go ahead and use the chat function to send us a message. We will have time at the end for questions and answers. Feel free to send your questions in at any time, and then we'll get to as many as we can. Now, let me introduce our host, Dr. Jennifer Shu. Dr. Shu is a practicing pediatrician, author, and mom in Atlanta. She's a frequent guest on national and local TV, radio, and web-based programs. Dr. Shu is the co-author of AAP books that include Heading Home with Your Newborn and Food Fights. She is also the medical editor of HealthyChildren.org, the official parenting website of the AAP. Welcome, Dr. Shu.
Thank you so much for having us today. 'Tis the season, and that's the season for cold and flu, as many of you might have been experiencing yourselves. So we are so grateful today to have our special guest, Dr. Lanre Falusi, a primary care pediatrician and associate professor at George Washington School of Medicine and Health Sciences. As medical director of advocacy education at Children's National Hospital, she develops community-based training for residents and studies health outcomes of public policy. Dr. Falusi also directs the launch track in the Children's National Residency Program, preparing pediatricians for advocacy roles. A spokesperson for the American Academy of Pediatrics, or AAP, she co-hosts a health podcast and has spoken widely on topics like poverty, immigrant health, and anti-racism. Dr. Falusi lives in Washington, D.C. with her husband and 3 daughters. Welcome, Dr. Falusi.
Thank you so much for having me. I'm looking forward to this conversation.
Excellent. So when we are talking about cold and flu season, tell our listeners what we're talking about.
So first, we're talking about something that is very common. Colds and flu are actually among the most common human ailments. As adults, we may suffer 2 or 3 colds per year on average. Children can get anywhere from 2 to 9 colds per year. So, I tell parents that when they feel like their kids are sick all winter, it's true. I validate that. Your kids really may be sick all winter. We know that those 2 to up to 9 colds are concentrated around fall, winter, spring. So you may feel that every month or every few weeks your child is getting sick. So what are we talking about when we talk about the cold and the flu? So common cold is really points to a number of different upper respiratory viruses. There's not just one virus that causes the common cold. These viruses can often cause symptoms like sneezing, cough, runny nose, stuffy nose, and then other symptoms kind of all over the body, like body aches, low-grade fever. Some kids may get a sore throat, diarrhea, vomiting, skin rashes. Those are all common with some of these viruses. And now that's different from the flu. So flu is short for influenza, and it's caused specifically by the influenza virus. There are a number of strains of influenza. You've probably heard about different strains that kind of go up and down from year to year. And they have symptoms similar to a cold, but they often come on faster and may be more severe than a cold. So flu symptoms may include fever or chills, fatigue, muscle aches, ear pain, irritability, decreased appetite. You may see some or all of those symptoms in a child who has the flu. So I get the question often, how long does this usually last? When should I expect my child to get better? So colds typically resolve within 7 to 10 days. Flu can last about 5 days typically. And then the question comes up of when should I be worried? When should I seek help? So we do recommend that parents call their pediatrician if their child has a fever, either of 104 degrees or higher. If you have a baby, our threshold for fever is lower, 100.4 or higher. If your child has difficulty staying awake, if there's persistent vomiting, any trouble breathing, if your child is looking dehydrated, those are all reasons to call your child's pediatrician.
Excellent. Thank you so much for that overview. So, if your child does have a cold or flu, what are some things that parents can do to help relieve these symptoms and without a prescription?
Yeah, so I like to think about this as having a cold and flu season survival kit. So a few things to have ready on hand when, the inevitable happens. Things that are easy to use for when your child is starting to develop these symptoms. So this can include a few things. So one for that congestion, the nasal congestion, keeping your child hydrated and comfortable is really important. So this is where that old adage about chicken soup comes in. So if there's something that your child likes to eat or drink that can help them feel better, we know that comfort food can do wonders. And then for a stuffy nose, nasal aspirators can help to unclog that stuffy nose. Saline rinses are really great to use. Saline mists are great, really helping to relieve that nasal congestion. For kids who have a cough, honey can be really helpful for coughs for kids over the age of 1. It's effective, it's a non-medicated strategy. And I usually recommend, as you can see on the screen here, for our younger kids, age 1 to 5, about half a teaspoon of honey. For kids age 6 to 11, a full teaspoon of honey. And then for kids 12 and older, they could take two teaspoonfuls of honey to help soothe that sore throat. There are a number of topical treatments also. May be familiar with some vapor rubs. So these can help to ease that nighttime cough. They should be used for kids only 2 years of age or older. And the recommendation is to just rub a thick layer of that mentholated rub on top of the skin on the chest and in front of the neck or throat area, avoiding the face, eyes, mouth, of course. So the way that these work is that the warmth of the child's body helps to release the medicated vapor into the air slowly over time. And then your child breathes in the soothing vapors, and that helps to relieve the cough so that they can sleep. If you do use a mentholated ointment, there are a couple of things to keep in mind. So first, put it away and out of reach of children when you're not using it. Only use these rubs on top of the skin. Again, they're not meant to be eaten or put inside the nose. And as with any medication, of course, read the directions and follow those directions closely. All right, so what else should be in your toolkit? Humidifiers and warm baths. So we know that in the winter time, outside air gets really dry, there's low humidity. And then what we can do is keep our indoors a bit more humid, and that can help to relieve stuffy nose, congestion, those symptoms that are due to that dry air, dry noses, nosebleeds, itchy skin, chapped lips. So what you can do is get a cool mist humidifier or vaporizer, and that can add moisture to the air, which helps to ease the congestion and dry throat. This is especially helpful at night. So be sure, of course, to follow the manufacturer instructions and clean these products often. Otherwise, they can grow mold or bacteria, or there may be buildup of materials. Warm baths can also help to soothe discomfort and ease breathing by creating steam. And of course, for babies and young children, to keep them safe, be sure to stay with them at all times when they're in the water. You can also have your little one in the bathroom sitting with you while you're running a steam shower, and that steam helps to relieve that cough and congestion. And then last thing I'll say in terms of that, cough and cold survival kit is thinking about fever reducers. So over-the-counter medicines like acetaminophen, ibuprofen, those may be helpful if symptoms are interfering with sleep. So if your child has a fever, they're really uncomfortable and not able to sleep, definitely think about reaching for acetaminophen or ibuprofen. However, we do have to say, never give aspirin to children due to health risks. There's a severe reaction that young children can get if they take aspirin. So we really just focus on acetaminophen and ibuprofen.
So lots that we can do without even a prescription when kids have colds.
Absolutely.
So wouldn't it be nice if kids didn't get these illnesses in the first place, or if we didn't get sick? Are there any ways that we can prevent some of these illnesses?
Yeah, I love this question. As a pediatrician, we're always thinking about prevention and thinking more upstream. I would love to be able to prevent all coughs and colds and flu. Unfortunately, we can't prevent them 100%. They are contagious, and they can travel from person to person. But there is a lot that we can do to reduce our risk pretty significantly. So first, think about how you can strengthen your immune system or your child's immune system. And these are just very basic things like adequate sleep, balanced nutrition, healthy lifestyle. Those can actually help to support a child's immune defenses. Hydration is key, especially with fever, vomiting, or diarrhea. What fluids do is they help to prevent dehydration. They can also thin mucus so that your child can breathe more easily. Drinking fluids can soothe a sore throat from coughing. Electrolyte drinks or warm caffeine-free teas can also help your child feel better faster. And of course, we have to mention hand washing. This is one of the best ways that we have to prevent the spread of viruses. Washing with soap, we know you can sing happy birthday or whatever song that's 20 to 30 seconds to remember how long to wash, and making sure to wash all surfaces of your hands, and then drying those hands is a great way to prevent spreading those viruses and bacteria. And then as your child gets a little bit older, teaching them how to cover their sneezes and coughs is really important, and doing that into the crook of their elbow or shoulder. Even using a tissue is fine as long as they put it into the trash right away and wash their hands. A handkerchief is fine as well. All of that is better than covering the mouth with the hands while they're sneezing, because again, we know that hands right after that go and start touching other things. So also important really to keep your child home from school or childcare if they have symptoms. So if you're sick, stay home so that we can prevent the spread of these illnesses. And then again, thinking about prevention, getting a flu shot every year is really critical. The AAP recommends everyone from age 6 months and up to get their annual flu shot. One of the best ways that we have to prevent what can be a severe illness. So 100% prevention of all of these things, probably not, but with the common sense things around healthy lifestyle and keeping hydrated and washing our hands, there is a lot that we can do to reduce our risks.
Excellent. So once you do get a cold or flu, what about antibiotics? A lot of patients ask me, well, will an antibiotic help me get better faster?
Yeah, that's a great question, and important to talk about that. So most upper respiratory illnesses that we've been talking about are caused by viruses, which means that antibiotics will not work to help your child feel better because antibiotics attack bacteria rather than viruses. There are some infections that should be treated with antibiotics, such as one, strep throat, and that is based on a positive strep test or throat culture. Secondly, if your child is breathing, it was starting to get better and then they get worse again with a new fever or new symptoms, then you may want to have your child evaluated. They may be developing pneumonia or sinusitis, or if there's now ear pain, that could be an ear infection, and those are treated typically with antibiotics. Or if your child is diagnosed with whooping cough or pertussis, that is also typically treated with antibiotics. So for the most part, these conditions require like really good physical exam, looking into ears and listening to chest. Some require testing to diagnose. So all to say that if you are concerned, definitely seeing your child's doctor is the first place to start. But for the most part, most winter illnesses do not require antibiotics.
Okay, so trying to avoid antibiotics, but sometimes using over-the-counter or home remedies. What do parents need to be aware about? Are there any considerations if you're using, say, a cold and cough medicine or fever-reducing medication?
Right. So there are lots of over-the-counter oral cough and cold medicines when you walk into the drugstore. And I know for parents, it can be really confusing. Sort of, where do I start? There's so many, and at what age are they safe? So generally speaking, these products, so cough and cold medicines, should not be given to infants and children under the age of 4 years because of the risk of dangerous side effects. Also, recent studies have shown that they just don't work. So if we know that they may not be safe and they don't work, all the more reason to avoid those in our young children. In addition, many of these products contain acetaminophen. So if you're already giving acetaminophen to a child who has fever or fussiness, and then also giving a cold medicine that has that same ingredient, you could risk giving too much. So instead, we recommend prioritizing non-medicinal symptom relief. So we mentioned some of them earlier, like using a humidifier or vaporizer or saline rinse or sprays, mentholated rubs. Those are things that can ease your child's symptoms. Um, for medication, though, if you are reaching for a fever reducing medication, just remember that not all fevers need to be treated. But if your child has a high fever and they're very uncomfortable, then certainly consider giving them a medication, and reach for that medication that has one single ingredient. So either acetaminophen or ibuprofen. And then, of course, following those guidelines around dosing really strictly based on age and weight, super specific for children, that looking on the side of the box, or calling your doctor's office can help you figure out what is the correct and safe dose for your child.
Excellent. So we are getting lots of questions in from our attendees, and feel free to keep putting those into the chat box and sending them our way. We also got some ahead of time when people registered. But before we get into the questions and answers, Dr. Falusi, is there anything else you'd like to add?
Yeah, just emphasizing a couple of things that we've said. There are those common myths about antibiotics curing viral illnesses, just emphasizing again that antibiotics are ineffective against viruses like colds and flu. And really wanting to emphasize that preventing spread within the family. So we want to encourage frequent hand washing, disinfecting common areas, and then keeping sick children away from siblings to reduce transmission. And then finally, just honestly saying to parents that we know that this is stressful. Caring for a sick child may be stressful, is usually stressful. I have 3 kids under the age of 10, so I get it. So just want to encourage parents out there, if your child is sick, take a break when you can, seek support from family members or friends, trust your instincts, and trust your pediatrician's guidance as well.
I think there's that old saying where you have to put on your oxygen mask first. You can't take care of other people if you're not well. So make sure
Absolutely.
parents are taking care of themselves.
Absolutely.
Okay, so let's move on to our questions and answers. Our first one is, how can you tell the difference between colds and allergies?
Right. So as you said, tis the season for sneezing and coughing and runny nose. And how do you know whether it's allergies because it's still fall, or they getting sick with winter viruses? There are similar symptoms between allergies and colds. A couple of ways that I can distinguish those. So first, with allergies, a lot of times the main symptom is itching. So your eyes are really itchy, your nose is itchy, your throat is scratchy. If you're feeling those symptoms, that's more likely related to allergies. We often will see red eyes or sneezing with allergies, which you can see with colds as well. But that sort of constellation of itchiness and red eyes and sneezing, I tend to think more allergies than colds. And then with colds or flu as well, you're more likely to get those what we call systemic symptoms. So kind of like whole body symptoms, fever, muscle aches, fatigue. If you're feeling those symptoms, more likely viral than allergies. So none of this is 100%. But if you're unsure and then trying to figure out if your child needs medication or not, again, call your pediatrician's office and they may be able to guide you toward the right way.
Thank you. We got a question from Natalie in the audience. Natalie asked, how do you balance when you need to keep children home from school or daycare? Because otherwise they'd be missing a lot of time too. So how do you know when it's absolutely necessary to keep them home?
Right. That's such a great question because, again, with up to 9 colds a year, a kid could be home all year long if we keep them home for any symptom. So generally, I would say the guidelines are often specific to a school district, or daycare. So they may have their own specific guidelines. But generally speaking, we do say that a child is safe to go back to school or daycare if they've had no fever for at least 24 hours without medications. So if your child has no fever, but you're also giving the ibuprofen every 8 hours, that doesn't count. You have to stop the medications and then wait 24 hours and see if they stay fever free. And then if also generally their symptoms are improving, so less cough, they may still have a runny nose, but they're able to breathe comfortably through that. They're able to keep food down, so the appetite is better. Those are ways to gauge if a child is ready. No vomiting, no diarrhea. And some things are a little bit harder to quantify. Like if your child looks like they have good energy, they're ready to learn, that could be a sign that they're ready. If they're just too tired, then and even without a fever, that's probably a good reason to keep them home if you don't think that they'll be awake enough to be able to learn. So again, if you have questions, probably best to double check with the school or daycare. But hard and fast rules really mostly around fevers and able to breathe comfortably and seeing some improvement at least in symptoms like coughing.
Excellent. Our next question came from Megan. Megan is asking about anything that adults and children can do to prevent colds, to help our immune systems. She mentioned that her kids have had strep many times. What do you think about things like elderberry or vitamin C? And I've heard other people recommending zinc.
Mm-hmm.
Tell us about natural things.
Yeah, so I definitely understand the desire for natural remedies and for prevention too, of course. The difficulty is that a lot of these remedies are marketed as supplements, so they're not FDA regulated. So the safety is, uncertain. There's also not enough data to say that they are effective broadly, though, of course, some kids may respond to some remedies. So I would just say, read the labels carefully, double check what they recommend in terms of age and dosing, know that you may see an improvement in symptoms, or you may see that, you have fewer colds this year because you were taking that remedy and were able to prevent those, but we just don't have enough data to say to recommend with certainty that, most kids or all kids should take those. So I would just say, again, keeping tabs on what the safety profile is from what you can glean. But again, just a reminder that they're not considered medications. So we don't have as much research or certainty around them that we would for maybe from other treatments. The one natural remedy that we do recommend that I mentioned earlier is honey, especially for soothing a sore throat or soothing a cough when symptoms start.
The next question is about newborns. When is it safe to take newborns outside or have them around other people?
Yeah, so of course, when you're home with a newborn, sometimes you're just craving to get outside and get some fresh air. So I understand that desire to go out, take a walk. So first, I would say maybe consider the outside temperature. If you are uncomfortable and shivering, or if you are, sweating and, getting dehydrated yourself outside, then it's probably too cold or too hot for your baby. General rule of thumb is consider what you would wear to be comfortable at whatever the outside temperature is, and then add one extra layer for your baby. Because they just don't have as much of that, body fat to be able to keep them warm. So that's one way to make sure that your baby stays warm. And even when it's really hot outside, then consider, if it's what coverage you have in terms of sun exposure. The opposite end, kind of where we are right now in this time of year, consider what coverage for like cold winds, for example. So again, if it's uncomfortable for you, then probably best to keep your baby inside. And then around other people, the one caution I would just say is that for babies under 3 months of age, just remembering that our youngest babies, if they have a fever, that does usually need some type of workup. So an evaluation with the doctor, sometimes we get tests for urine or do blood tests. So probably best to avoid large gatherings for babies under 3 months of age. Beyond that, we all need socialization. We all need time with our friends and family. So just consider the kind of spectrum of safety around that, ensuring that everyone is washing their hands, and that if people are sick, that they're staying away from these gatherings. And then if you're going to be around someone long-term, family members coming to stay with you for weeks or months, for example, talking with them about their vaccination status around some of these common illnesses like pertussis, for example, flu, COVID, RSV even. So depending on age and access, talking through what they've been vaccinated against and what we can do to help prevent those illnesses passing on to your baby.
So kind of playing off what you were saying about vaccinations, some of these are only indicated for certain ages. So for the youngest babies who can't get flu or COVID vaccines, how can we protect them?
Yeah, so the best thing we can do is to form a hedge of protection around them with all of us getting vaccinated. So anyone who's around a young baby, anyone who's 6 months or older, that's around babies under 6 months of age, we definitely encourage you to get vaccinated as the best way to prevent flu or COVID passing on to these babies. So again, we can start vaccinating at 6 months, and prior to that, that herd immunity, vaccinating everyone around that baby is the best thing that we can do. And then on top of that, of course, just to reiterate, washing your hands, staying away if you're sick, and considering, kind of where the baby goes and how many people they may be exposed to.
So we now have an RSV shot that can be given as early as newborn period. Is there anything you'd like to say about RSV infection and the shots?
Yeah, so RSV, you can get similar symptoms as with the cold and the flu. When I think about RSV, I think about thick, runny nose, cough, and in many younger kids, wheezing. So that wheezing sound in their chest, which we call bronchiolitis. Typically diagnosed clinically, a doctor may perform a nasal swab to test for RSV or other viruses, though that's not always necessary. So as you said, yes, we do now have protection against RSV with a few products that are out there. Some have been around for years, some are newer. With kids, it's not exactly a vaccine that's given to prompt the immune system to produce antibodies like how we normally think about vaccines. With kids, it's rather what's called passive immunity, meaning the RSV shots that are available for children contain the actual antibodies against RSV. They are recommended, as you said, from birth through age 8 months. For some older babies and toddlers, they may be eligible to receive it if they have certain health conditions. For adults, the RSV vaccine works more like a traditional vaccine. Also, really great news if you're pregnant and you get the RSV vaccine between 32 and 36 weeks of pregnancy, then you're actually passing down that immunity to your baby, and your baby doesn't need to get vaccinated after they're born. So really great ways that we have now to prevent RSV, and from newborns all the way to older family members.
Our next question has to do with croup. So sometimes kids can get a cold virus, which is your typical runny nose and cough. What
Mhm.
is it? When does it turn into croup?
Yeah, so croup specifically is about upper airway infections. So with croup, we see swelling and mucus in the upper airway, which makes it difficult to breathe. The hallmark is that barky cough that kids can get with the croup. The treatment is similar to other illnesses, so steam, fluids in particular help croup to reduce that swelling, that inflammation that's happening in the upper airway. Some kids require steroids to reduce the swelling. Most kids don't, but when you are starting to hear that barky cough, especially if it's not getting better with fluids or with steam, that's a good time to call your child's doctor. So you may see croup. We see it really all year round, and can cause that sort of scary cough. But I will say that oftentimes the cough sounds worse than the child feels. So your child may not feel that sick, but have that really barky cough. And if that's what you're seeing, the first step again is sort of steam and fluids. I'm going to call your child's doctor if you're concerned at all.
Okay. I saw a link come through talking about whooping cough or pertussis.
Mm.
What can you tell us about that and how does that differ from croup and common cold?
Yeah, so pertussis, whooping cough is very contagious. And the symptoms may be similar to a regular cold, runny nose, fever, mild cough. But what distinguishes pertussis is that oftentimes a child will have those initial symptoms and then they start developing these coughing fits that can last for weeks, sometimes even months. So that prolonged cough is something to look for with pertussis. There is a vaccine against pertussis. Kids get it as part of the routine vaccine series. So we've definitely seen much less pertussis over the years thanks to the vaccine. For people who do get pertussis, The treatment is typically with antibiotics, and these are especially effective if they're started early in the course. But if you're now in the time where you may have coughing fits, things like steam, fluids can help to reduce that cough. Rest, of course. And then, some kids do get fever or discomfort with pertussis, and that's where acetaminophen or ibuprofen can really be helpful. Just one last thing about pertussis, again, being very contagious. If your child is diagnosed with pertussis, or if you suspect that, and if they're diagnosed, keeping them home and away from others is super important, because it really can spread really quickly throughout a classroom or daycare.
Right. And so sometimes you'll see whole families might need to get treated.
Right.
You
Right.
mentioned that it can last weeks or months. So the nickname is 100-day cough, because it can
Right.
really last that long. And really, I think the scariest thing about whooping cough is that babies who get it can actually stop breathing. It can cause
Mhm.
apnea, and that is
Mhm.
super, super scary. So any
Mhm.
concerns that your baby might have whooping cough, I would definitely recommend them being seen by the pediatrician.
Absolutely.
So our
Mhm.
next question, um, I don't know how much you've been seeing, but I've never seen so much mycoplasma or walking pneumonia in my
Yes.
life. In my many years of practice, this is the most I've ever seen. What are you seeing as far as, how do you know if somebody has walking pneumonia? What is walking pneumonia?
Yeah, I agree. There's definitely been an uptick across all age groups, it seems like. So mycoplasma is the bacteria that causes walking pneumonia. So the bacteria mycoplasma can also cause bronchiolitis, croup, other infections, but I think we commonly think about pneumonia. And it's called walking pneumonia because the symptoms are typically mild. You may be able to still move around, do your normal daily activities, although we know that it's not the case for everyone. And I've known people personally who've had it recently, and it was not a mild case. So some cases are more severe, either with a prolonged cough or with fevers. So just to keep that in mind. The good news is that antibiotics are not always necessary for mild symptoms, but your doctor or your child's doctor may prescribe antibiotics, if the symptoms are severe, or if you have an underlying medical condition. Again, so do see your pediatrician if you're concerned. Cases are on the rise in many parts of the US this year. But fevers, I would say, would be a reason to go see your child's doctor. Again, mild symptoms, you may not need to go in to be seen, and just kind of treat them with rest and fluids. But once you start seeing a fever or any difficulty coughing, or if now the cough is prolonged, those are good reasons to have your child checked out.
So let's switch gears for a second from the actual, illnesses, infections. Let's talk more about symptomatic care, what we can do for our kids when they get sick. Can you tell us a little bit about saline mist or spray or drops, and the different types of suction that you might use if your child is really stopped up and having a hard time breathing through their nose?
Yeah, so these work really well. So saline, it's just salt water. It can come in drop or spray or mist. Um, there, among those three versions, one is not necessarily better than the other. It all kind of depends on comfort or your child's age. I find drops to be easier for babies, as you're kind of holding a baby, being able to control the drops a little bit more easily. Older kids may prefer a mist or a spray, especially if you're kind of administering it as they're standing up. Suction is one of my favorite things when it comes to treating a cold, because it is so satisfying to kind of free up that congestion. And there are different kinds of suctions. The bulb suction that you may remember going home from the newborn nursery with, that you kind of squeeze and can use that reverse pressure to reduce or to relieve the congestion. Those work fine. I'm a big fan of the snot suckers that look more like a flexible straw. There are a lot of different brands of these, but generally they work by putting one end in the baby's nostril and the other end in your mouth. They do come with filters, so that snot sucker is not putting snot into your mouth. So you're able to kind of use your own suction to reduce or to remove that congestion. There are electronic versions of these now as well for parents who prefer that. And as I said, I think they work really well to relieve that congestion. Of course, know that you may have to do this multiple times a day. What I recommend is typically clearing out the nose before feeding and before sleep. You know that as you're feeding, you need that air movement through your nose while you have something in your mouth, especially for babies who have a bottle or breast in their mouth as they're feeding. We need them to have their noses clear. And then at bedtime, if you're at least starting the night with a clear nose, able to breathe, that makes it a little bit easier for the child to fall asleep and to be able to have a more restful night.
Okay, a couple more questions left. The first one is this attendee has heard about using the ointment that's typically used on the chest, like a chest rub, on a baby's feet. Is
Mm.
that thought to help? What are your thoughts on that?
So I'll say I know a lot of parents and grandparents swear by this. Currently, there is no evidence to support that in a very strong way, to support, kind of putting the rub on their feet as a way to prevent or reduce cold symptoms. But rather, at least for kids age 2 years and older, what we recommend is rubbing a thick layer of that mentholated rub on top of the skin on their chest. Or the front of their neck. Because again, the way that they are meant to work is that as that vapor gets released, your child is then breathing in the vapor that reduces the congestion and swelling in their nose and upper airway. So again, having heard all of the advice from grandparents, I hate to say that it doesn't work because I know that some people swear by them, but I will say that we don't really have the data to support that. But we do know how they can work for sure by placing them on the chest or in front of the neck.
So maybe not harmful, but maybe not helpful either. So
Exactly.
actually, we have like 3 or 4 more questions. What about remedies that don't have an expiration date on them, or if it's past the expiration date for a cold medicine or a chest rub, is it still safe to use?
Yeah. So, if we want to make sure that what we're giving to our kids are safe and effective. So to have that really safe and effective use, it's really important that we read the product label. So I appreciate this question and thinking about and noticing and thinking about that expiration date. So, according to FDA and pediatrician groups, medication products that have an expiration date where the past expiration date should not be used. So that expiration date is, reflects the time that the medication is known to be stable. It has the right strength and quality and purity. Past that date, we cannot guarantee that. So that's why beyond the expiration date, really, we recommend not using an expired product. Now, some products don't have an expiration date. I know that was part of the question. If you don't see an expiration date, then kind of go by your senses. If it looks different than it initially did, you can go by smell or the ingredients separating, it's the oil layer separating, that sort of thing. Those may be reasons to consider not using it. And I'd say, especially for kids, if there's anything in question, if you're, even just past the expiration date, or if it just looks a little weird, I'd probably just throw it out and get a new one. Or ask your doctor for what would be a good alternative if you're past that expiration date.
And then some pharmacies will take back expired medications too, so
That's
that
right.
we're not throwing them into the, whatever, just a garbage straight or into the water supply.
Right.
Um,
Right.
There's a possibly quick question. Stacy would like to know if a parent can take the RSV vaccine during pregnancy, and will the baby get immunity through breast milk?
Yeah, so it is recommended to get the RSV vaccine during pregnancy. There's a certain time in the third trimester when it's given. And if it's given during that time, so between 32 and 36 weeks, then your baby does pick up that immunity, which is wonderful. Through breast milk, there are many wonderful advantages to breast milk, including potentially decreased risk of infections. It doesn't work exactly as the antibodies from the vaccine coming through the breast milk necessarily, but there are ways that we know that breast milk can reduce the risk of infection. So getting the vaccine is super important during pregnancy. And if not, if you miss that window, just know that once your baby is born, there is the RSV shot that they can get in the first 8 months of life.
And to clarify, that vaccine is only for use during pregnancy. There is another one for adults That's
Correct.
for over what, 75 years of age or over 60, possibly younger, if there are certain medical conditions. So in general, no, there's not a vaccine to take for a mom who's breastfeeding, who's
Right.
already had the
Exactly.
baby. Okay.
Exactly.
We have one more question from Caitlin. So if a child has symptoms, is there a certain amount of time that you should wait before you contact your pediatrician? Or you just go as soon as the symptoms start? How can you decide?
Yeah, I think it depends on the symptoms. For the most part, you do have some time to kind of watch your child. The symptoms that would require immediate evaluation, I would say, are difficulty breathing, or if your child is not very responsive, or they're not able to hold anything down. So they're vomiting or having diarrhea or not wanting to eat or drink, and they're starting to look dehydrated now. So they haven't urinated in 6 hours or more. They're looking dry. So for those symptoms, I would say go ahead and see your pediatrician. If your child's having severe trouble breathing, then calling 911 or taking them to the closest hospital is probably your best bet. Other symptoms like a cough but without trouble breathing, or runny nose, or even fever can typically be watched at home, and not you may not have to go to the doctor right away. We definitely want to see a child who's had a fever for 5 days or more. Less than that, again, kind of going based on the symptoms. If your child is able to at least keep down some fluids, maybe a little bit of food, if they're awake and alert enough to, go about the home, do some of the basic things. If they're breathing comfortably enough that you can have conversation, you're not worried about their breathing, then they probably should maybe stay home if they're having a lot of cough or having any fever, but you may not have to take them to see the doctor right away. And a lot of offices will also be able to give you advice over the phone. So that's something to consider as kind of a stepwise before going in, calling in and doing what's called a phone triage may be helpful. If you have concerns, as pediatricians, we're here, we understand that parents can get worried and it can be stressful trying to figure all of these things out. So we're here to help, but bottom line, if you are concerned, just go ahead and go to your pediatrician or give them a call if it's kind of hard to figure out from what you're seeing at home.
Dr. Falusi, thank you so much for all that excellent information today. I will now turn things back over to the AAP to wrap up our webinar.
Thank you so much.
And thank you both so much, Dr. Shu and Dr. Falusi. That really was great information. We appreciate you sharing all that. We'd also like to remind participants to register on healthychildren.org for our e-newsletter, personalized homepage, and special offers. And we invite you also to follow us. Follow Healthy Children.org on Instagram, Facebook, and Pinterest. Also, subscribe to our new Healthy Children podcast. You can listen to it wherever you get your podcasts, or just go to healthychildren.org/podcast. We really hope you enjoyed today's webinar. You'll be receiving a short survey from us soon. Please feel free to let us know what you found helpful and what suggestions you may have. And finally, a very special thank you to our sponsor, Vicks. Thanks again for joining us.